Welcome to On The Beat, everyone. I'm Troy Thompson. I'm joined by Fondren from Omnis Health Clinic, and today we're talking all about the autoimmune thyroid disease. I love this topic. Welcome to the show, my friend.
Thank you.
This is such an extensive conversation that we can't get it all within the 4 minutes 30, but it's something that goes undetected in the human body until you see serious signs, right?
Right.
What is autoimmune thyroid issues?
So autoimmune thyroid disease is a disease where the body attacks the thyroid gland and the thyroid hormones as if it were a foreign invader into the body. And so you can start having a lot of symptoms of thyroid disease.
And that's what I want to ask you. What are, because look, everyone's sitting at home, okay, watching you giving this interview, and one of the most important things that we like to get across is what are those issues that people at home can all of a sudden go, you know, she's right, I've got to call her. What are some of the symptoms that someone may be experiencing?
So there's two different types of autoimmune thyroid disease. There's Graves' disease and there's Hashimoto's. And one type, Graves, causes hyperthyroidism. And with hyperthyroidism, you can experience racing heart, heat intolerance, a general feeling of extra anxiety.
Really?
Yes.
Hashimoto's?
Hashimoto's is where you have a hypothyroidism situation and you'll experience dry skin, higher blood pressure. You can experience fatigue and feeling tired, low motivation, depression.
And that's really scary because a lot of people take all of those symptoms, especially when it comes to Hashimoto's, and think they're clinically depressed.
Right.
When we can fix this just by coming in to see you.
We can.
Okay, I'm a new patient, I'm coming in, I have some of these symptoms that you just described. What process do we go through at your clinic to diagnose?
Besides a good physical evaluation, including a thyroid evaluation, we do a pretty extensive lab panel that looks at all of the thyroid hormone levels, and we look at all the other lab levels as well.
So when we say lab, we're talking about blood?
We are.
Okay, now how long before we find out we may have some of these issues when we come in and see you?
Lab work usually takes 2 to 3 days to come back, and if there's very many things that we need to discuss, we'll have you back into the clinic and we'll discuss everything.
I love that you say back into the clinic. I can't bear it when they call you and tell you over the phone because I'm like, I don't understand everything you're just talking about.
That's exactly why.
What happens when that goes through? We've come back in, you've told us we may have Hashimoto's or autoimmune disease, thyroid disease, I should say. What is the process of fixing it, and is it fixable?
It is fixable.
Okay.
There is thyroid hormone medications that patients can be prescribed that correct those deficiencies that the autoimmune disease causes. And when we prescribe those, the patient takes them as directed, and all of the times when you get the right amount of medication for that patient, those symptoms go away.
And a lot of it, can I be honest with you, it has a lot to do with our lifestyle too, doesn't it?
It can, yes.
So we're talking cleaning out, getting rid of gluten out of the diet.
That's very correct.
What are some of the other key things that people could do sitting at home right now that they could take out of their diet and see how they are in the next 2 weeks very quickly?
Especially gluten is important in autoimmune thyroid disease. A lot of wheat or grain-based products is the main thing.
That's what we've got to get rid of to begin with, right?
Right.
You always give us great information. Thank you. We really appreciate it. If you want to find out more information, there it all is up on the screen for you. Omnis Health Clinic, and we've been chatting away with Fondren.